More is Dr. Homo Kothary, the Chief Medical Officer for Dignity Health Central California Division. Good morning, Dr. Kothary. Thanks so much for joining us again.
Good morning, Alex.
Well, let's talk about this new death that we saw yesterday. This is the 4th confirmed death in Kern County. But again, we keep talking about how our fatality rate is fairly low compared to other counties in the state of California. However, we did see another death reported yesterday, and there's 22 people that are in the hospital as of last check, according to public health. Should we be a little bit more concerned about where we're headed, what the future may look like as we continue to see more people in the hospital and our death rate slowly but still rising?
You know, we are predicted to hit our surge April 26th, which is this Sunday. So it's going to be very interesting to see what happens over this week, this next 4 or 5 days. And that will kind of tell us where we're headed. So, you know, I think we still need to be extremely cautious. We need to, you know, social distance and stay at home. You know, if you're not an essential worker, you know, please stay at home for now.
Okay, so you talk about our surge here for, I'm assuming you mean Kern County surge, right?
That is absolutely correct.
So we talk about Kern County surge being possibly this Sunday. Meantime, the rest of the country is talking about reopening businesses. As a matter of fact, some states in the South are actually opening up for business. Some counties are and some states are. Are we well behind that? Are we still weeks away from even talking about that here in Kern County, do you think?
You know, we've been talking about a lot of that. You know, I know the governor has been talking about that a lot as well. And it's, you know, everyone's eager to open up businesses. So I think what we're going to have to do is just sit and wait. I'm hoping that we don't really have a surge this week. If we don't, we can open up businesses safely in the next week or two. We're planning on opening up our hospitals to elective surgeries first week of May. So we're already preparing to open things up, hoping that nothing bad happens.
One of the things that we received overnight was in the Bay Area, there were 2 new deaths reported for coronavirus. But what's interesting about these 2 deaths is that it came weeks earlier than what was originally thought of as the first death in the U.S. on February 29th. So these 2 new deaths in the Bay Area come on February 6th and the 17th after autopsies were done. Do you think that we could see more cases like this where people had coronavirus or died of coronavirus, maybe here, especially on the West Coast, well before testing was really ramped up?
Absolutely. There's a lot of specialists that believe that the virus was here late fall last year. So, you know, a lot of people did pass away, and we attributed a lot of them to the flu or pneumonias. We didn't have any testing for the virus at that time. So it's very likely that this virus was here towards the end of last year.
Do you think that it is possible that people who died of the flu in Kern County could have possibly died from coronavirus?
It's very hard to say, obviously, because we did not have the testing at that time, but it is likely.
What about this disease? I mean, because if you say it's possible that this disease was here, you know, in California or in the U.S. in the fall, when we really didn't hear about it until, you know, early January, late December, early January, why is this timeline changing so much?
You know, we're just basing it on the data that we received from China. You know, when China let us know that they had it in Wuhan, that's when we started, preparing ourselves for it. But, you know, there's a lot of travel in and out of China, especially certain parts of China. There's a pilgrimage that certain people in Iran went through to China, and they were taking the virus around as well. So it's really, really difficult to know exactly when the virus was around, but we're basing all of what we know from what we've been told.
As we continue to prepare for the surge here locally, as you say, what should people be doing right now?
You know, doing exactly what we've been doing for the last month and a half, a little over a month. So, you know, staying at home, non-essential workers stay at home as much as you can if your job will let you. And then also practicing that one favorite thing we've been talking about, social distancing.
All right, Dr. Kothary, thanks so much for joining us this morning. And just a reminder, you will be joining us on our Facebook Live coming up at 7:10 this morning. So we'll be able to answer, you'll be able to answer questions that our viewers have coming up again at 7:10. That's in about 30 minutes. Dr. Kothary, thanks so much for joining us. We'll see you tomorrow.
All right, thanks, Alex.
Okay, we'll be